And I joke about this all the time. It's like this idea of informed consent. We ask the patient, do you accept the fact that you have the risks of these things? And we list all of them. And so I asked my fellow surgeons, did you consent to this? Did you consent to the risk of bleeding? Did you consent to the risk of death or stroke or things like that? And it's funny because if we are arguing with whether it's going to happen or not, we have not consented to this procedure. And if we were the patient, we would not proceed. So you have to consent yourself for the risk of what you're walking into. And that's one thing I think that we miss.
I love that. I think that is such an important point. I am a complete and total stickler during the consenting process, but I never asked myself if I consent to all of those risks of the procedure that I'm about to perform. And I think that is really total mindset shift of, the patient is accepting the risks and I need to be aware that these are the inherent risks of the thing I'm about to do. And yes, fundamentally, we know these things because we do these procedures, we do these surgeries, and we know that they're possible. And do you really believe it? And